Thank you, guys. I really look forward to this, Dr. Foster's. I really appreciate you guys letting me come out. First, I wanted to start things. I had something prepared, but I'm just not going to use it because you don't need any more statistics, I don't think. I just want to ask you guys a question. What can you do? Think about that. What can you do? I don't want you to walk out of here, feeling like you've learned a few more stats, you know a little bit more about pain and addiction. But what can you do as a layperson or as a physician or whatever your choice of specialty is, in life? You can do something. You can vote. That's huge. You can stop for a second when you're really busy and listen to the person talking to you. You can talk to your children. You can talk to everyone you love. And if there's other physicians out here, take a minute. I know how it is. We're one of the most needed and important jobs out there. But guess what? We have to fight to get our payment every month, every day. There is a panel on every insurance company that says, hey, you know what? Let's figure out a way to pay the doctors less. That's true. That's very true. Now, a lot of people don't know that. You guys have heard of deductible season that comes every year. That impacts us greatly. When the insurance company essentially stops paying and it's on the patient to pay for their care. People are going through some tough times. If you guys remember a couple of weeks back when the government shutdown happened, folks were losing everything for $400 and $500. Okay, so just think about what can I do as a person? One of the things I do with every patient, first I just wanted to say one thing. There's going to be a percentage of every population that has chronic pain that does not go away. These wonderful surgeons do a great job. Everything has gone right, and yet still that patient never really gets to a point where the pain goes away. And that's when they come to see doctors like me, Dr. Foster. And it's tough because at that point, they've gone to maybe 10, 15 doctors, they've seen the primary care, they're doing everything they can, and 85% of my patients cry at first visit. 85%. And they always, and at first I said, well, maybe I just look mean, maybe the beard is too, back in the day I used to, so I was like, well, maybe I just look mean. It's not that. It's that I stop and listen. You guys realize physicians interrupt patients more than once every 30 seconds? And that's just because we're trying to get information and stuff. But if you can, just stop and listen. Stay quiet for a minute. Hippocrates said that if you listen long enough, your patients will tell you their diagnosis, and that's very true. Sometimes we just need to be quiet and just listen. I take what I do very seriously. I'm a nerd. I'm happy to say it. I'm proud of it. Board certified in family medicine, emergency medicine, addiction medicine, and I'm finishing up my last little bit of a 6-year program for pain, and I've never been more satisfied. I opened my office as an investment, honestly. I wasn't even planning on doing pain, but we kept getting such bad physician satisfaction scores that I was like, I gotta do it. So I went back to school and started learning. And I just wanted to kind of be an adjunct doctor to come in every once in a while, make sure everything's going okay. The first day I worked, I said, I came home to my lovely wife that I'm very, very proud of, Dr. Damon Kimes sitting in the audience here. And I said, I can do this every day. And I did. So I transitioned from emergency medicine into pain every day, and now I'm able to take care of my family with just that one thing. So again, think about what you can do. You can listen, you can vote. You want to vote for bills that are going to protect healthcare. Doctors are not the enemy. We all feel bad because and to a certain degree, we feel like we've contributed to the problem. So I'm just going to share 4 things that I tell every patient. Every new patient, and I revisit this on visits. There's 4 definitions. If you understand these definitions, you're going to understand a lot about pain and the dangers of pain and addiction. Number 1, tolerance. All opioids share one thing, tolerance. You will get used to that medicine. And you're going to want more. If you're a patient that the pain hasn't gone away, you're going to feel like, well, I just don't get the effect anymore, doctor, that I had before. So I tell my patients that. And I said, that is just a function of normal body parameters. You're going to get used to this. It's not going to work. So I tell them, you have a choice. You can say, well, hey, I want more. That's most of the time the wrong answer, the wrong question, because it's not you have to go backwards. So the answer is really, I want to take less. I'm going to take less for a short time so that I'm not so used to the medicine so it remains having its function. So that's tolerance. And I talked to him about how we're going to lower your medication about 20% or more from time to time just to keep you around the safe level. I was really happy when the CDC came out. Dr. Deb Hourly, who I trained with at Emory, was very instrumental in that. And it came out with some guidelines because we didn't know, I mean, we're doctors and we read every day. All these guys here are nerds to some degree. We all go home and instead of having fun, sometimes we grab something and read it. But we didn't really know until the CDC came out with different guidelines of, morphine milligram equivalents. You guys know morphine is sort of the gold standard for pain. And we rate how much each medication is, how strong it is by comparing it to morphine. So finally we had something to say, okay, if you have a chronic pain patient, you want to keep them below this amount. So we really do a lot to make that happen. So we talk about tolerance and how you need to go backwards sometimes. Next is dependence. Dependence means if you take, and this happens to after 2 weeks, it's happening to any of us. I don't think people know that. Everyone wants to cast the blame and say, hey, the addicts are just weak-minded. Don't ever think that and don't ever speak it. One, we all have power in the words we say. So when you say someone is weak, imagine if you were an addict and someone said you were weak-minded. You're not weak-minded. I know plenty of addicts. I work at I'm medical director for 2 addiction facilities. I know people who brought in millions every year because they're brilliant. They didn't get that way by being weak. So dependence means that you're going to get used to that medication. And if you stop it, you can get really sick. Withdrawal is very tough. I know all of you guys have probably had the flu at one point in your life. Withdrawal feels like that, but you're going to vomit, you're going to have diarrhea, you're going to be sweaty. I mean, it's just a horrible feeling. Some people will keep taking an opioid just to get rid of that feeling. So I tell people that's something that's very real. And how does it happen in the pain practice? People take too much because of the first bit of tolerance. They just want to control the pain. Number 3, addiction. Addiction means that you will lie, cheat, steal, go to multiple doctors, do things that you know you shouldn't do. But despite knowing that, you do it anyway. Because what started off as a medical problem has become a medicine problem. Okay, so I tell people about that. And I tell them, I'm not just telling you what addiction is because you don't know. You know what it is. Maybe someone in your life, you felt that, or maybe you've dealt with it before. But what I tell people is, I just want you to know you can talk to me. And this is a way for me to remind myself to say this to every single new patient or every patient that comes to my office. You can talk to me. You don't have to lie. As the first physician said, people think we're part of law enforcement. You don't have to lie to me. If you've done something wrong, just tell me. Because I'm going to check your urine. I'm going to check the prescription drug monitoring program that's right here in Georgia. And I'm going to look and see if anyone's prescribed it. The only thing I won't know is whether some drug dealer is giving you something. But if it shows in urine, another thing people need to know is fentanyl does not show in your routine dipstick drug screen. It just doesn't show. So you can have someone using heroin, fentanyl, and it just doesn't show them and you don't see it. So people think it's simple and physicians should be able to see, come on. If it doesn't show in the test, how do you know? But how you know is you take a minute to get to know that person that you're treating so that they don't feel like it's just easy to sit there and tell you a lie. I listen. Sometimes my wife tells me I need to be a little more efficient. Maybe my discussion right now is taking a little bit too much time, so that might be part of it. But you know what? I can't change who I am. God has given me I realize now that God's given me a mission in life, and I sometimes wonder, why did you do all these boards? I was doing family medicine, then I did emergency. I was trying to find my calling, and finally I have. So, we talk about addiction, we talk about folks being able to talk to you. The only way someone's going to tell you the truth is you don't make them feel like, excuse my language, crap for telling you. Okay? So when someone, your patient or your friend says, hey, I got a problem, or you see the problem, don't scold them. That's not going to help. Tell them you're here, you're with them, you're going to do what you need to do. The last thing is diversion. I tell my patients, look, I know I'm not blind. I know some people will come in, maybe they do have a true chronic pain problem, but they also have a money problem. And they're gonna sell a portion of their bills. And I'll let them know from the start, we are going to check for that. How do we check? We do pill counts. We're gonna bring you back randomly and have you bring your medicine. And guess what? You think you're getting over because you're bringing Tylenol in when it's really supposed to be. We're calling it the drug, the pharmacy. We're gonna know what color, what numbers were on the tablet. We're gonna know. Now, don't tell them that part the first day. I kind of let them know that when they but we're gonna do everything that we can, okay? So I didn't want to talk too long, and I'm gonna kind of end with that. But again, what can you do, okay? So just think about that. In 2020, we need to vote for someone, or multiple people in our community are going to take action. Okay, not everything is how hard can I crush this person. We saw what crushing does, didn't we? In the 80s and 90s with crack cocaine, we were crushing people that are still in jail. People are in jail for 20 years because they were carrying a joint around. Okay, that's not the fix. Compassion works. Knowing what you're talking about works. Reading. Be a nerd. Learn about this stuff. And to all the physicians out there, please call other offices. We get so busy, and I understand, because we're trying to take care of our families. Everyone has this illusion that doctors are all rich and all this stuff. We're trying to do just what you're trying to do. Take care of our families and leave a legacy. One of my sons is going to take over my practice. He's an undergrad right now, and I always tell him, find out what are good habits and keep doing it. So I kind of want to leave it at that. You know, if any of you guys are physicians, call my office and say, hey doc, I got this patient, I don't know what to do. You know, we looked and we saw that, you know, pain physicians account for about 5% of the problem. That means there's a lot of other doctors, and they don't mean to do wrong or hurt anyone. They just don't have the resources. Not everyone has a lab that they can send all the urines to. Not everyone knows all the information that we pain physicians know. Give us a call. You know, curbside consults are cool. You know, I'm glad when a doctor calls me and says, I just don't know what to do. You can send them a CV, and if you have family or friends or people you love, find out who can treat them in your community and send them on. We're never gonna, I tell my patients, I will never make you feel embarrassed or sad or about anything. Just tell me the truth, I'm there for you. And last but not least, God is really the key, and I don't mean it. I know we're in 2019, and I guess people say you can't. I'm going to say God for the rest of my life. Yeah. Continue to speak positive only, you know. Last thing, and I did say last thing, but this is really the last thing. Addiction is a brain disorder. It's not a sign of weakness. Addiction is something that changes in your brain after it's been exposed to something, and it becomes beyond your power at times to fix it. So, you know, AA is one of the most effective treatments for alcohol, and people don't know why, but I do. It starts with God. Okay? So,